Don't walk into NCLEX without knowing this. Live versus inactivated vaccines. Let's talk about it. Because a lot of students get overwhelmed when you see vaccines. Because you think you have to memorize every single one. But before you start making flashcards, I want you to understand one simple concept. Can the vaccine replicate in the body? Because if you can answer that question, you're going to get a lot of these questions right. So let's start with live vaccines. Live vaccines contain a weakened version of the virus or bacteria. In other words, it's still alive, but it's weakened. Now, because it's alive, it can still replicate in the body. And that's why these vaccines create such a strong immune response. But here's the thing. Because they're alive, we generally avoid giving them to pregnant women and immunocompromised patients. Now for NCLEX, that's one of the biggest takeaways. Now on the flip side, let's talk about inactivated vaccines. These vaccines contain killed organisms or pieces of the organism. So unlike live vaccines, these cannot replicate in the body. And because they can't replicate, can cause the disease they're protecting against. As a result, they're generally considered safer for immunocompromised patients. So with these, I need you to think along the lines of injectable flu vaccine, hepatitis B vaccine, and COVID vaccine. Now here's another NCLEX pearl. I'll be quick. Since inactivated vaccines don't always produce a strong immune response, booster doses are often needed. And this is where NCLEX will test your understanding. Instead of asking you to memorize a list of vaccines, they'll give you scenarios, like a pregnant woman or an immunocompromised patient. They'll ask you, which vaccine should you give? And this is the time you're not going to panic, because you're going to remember that Nurse Raina told you to ask yourself, is it live or inactivated? Hey guys, I don't need you to know everything, but I do need you to be safe, prepared, and teachable.